So I'm the next speaker. I'll try to police myself. Okay. I've got my phone here. So I want to talk about, so I'm MacEachen. They sit at the University of Waterloo. And I'll be talking today about retirement pension poverty amongst, actually I don't need two microphones, I'll just, can you hear me now? Amongst injured workers with long-term workers' compensation claims. Okay, wow, this is fine. A blind spot in work and health research has been the focus on workers in retirement age. If you look at return to work research, and most work and health research is always focusing on people of working age, which is normal, right? I mean, work and health research focus on when you're working age. But it's important to look at what happens to injured workers in retirement age. And the reason why is because of how their retirement income looks, what their pension system looks. Now in Canada, we have normally what's called a three-pillar system. So when you retire after the age of 65 normally, we have some benefits, they're public benefits, and they have a poverty reduction function. So that's like old age security, guaranteed income supplements. We also have a public national contributory pension scheme, and that's our Canada Pension Plan. So whenever you're working, you and your employer are co-paying into that CPP plan. And the amount that you get paid out at the end depends on how much you put in, right? So there's also some voluntary pension schemes. So some people with really good jobs get employer-sponsored pension plans. There's also our RSPs and personal savings. But when people talk about a three-pillar system, they're forgetting about people who end up on workers' compensation schemes and what happens to them, because there is a fourth pillar. And that's what I want to talk about today. And I'm going to focus on the case of Ontario, but it's relevant to all provinces actually across Canada. But in Ontario, the fund is called Loss of Retirement Income Fund, and I'm going to describe it to you. So when you're on workers' compensation benefits, you're not working for an employer, right? You're being paid benefits by your workers' compensation board. And so you're not contributing to the Canada Pension Plan anymore, and you don't have an employer who's contributing to the Canada Pension Plan. So instead, this loss of retirement income pension is provided by the Workers' Compensation Board. So it's called the LRI plan in Ontario, and they say it's in lieu of CPP, right? Because they know that you're not able to contribute to your pension plan, the Canada Pension Plan. So guiding principles of this loss of retirement income fund that you get from workers' compensation, the Wheeler report in 1980 laid it out. They said the Workers' Compensation Board, as the last insurer for injured workers, should make up any income losses related to workers' loss of contributions to the Canada Pension Plan. So they're thinking about, okay, are these workers, how are these workers going to live after they turn 65 if they're not contributing? Workers' compensation benefits are intended to replace the income loss as a result of injury, with the recognition that workers cannot sue the employer for creating adverse or dangerous working conditions, right? So if you're on workers' compensation benefits, there's an understanding, a historic compromise, that your lost income should be replaced. And so this is where contributions to an old age pension fund come into the picture as well. So how does the Loss of Retirement Income Fund work, this WSIB fund? Up until 1998, WSIB contributed an amount equivalent to 10% of the workers' net benefits into this fund that the workers then became eligible for when they turned 65. But at that time, benefits were actually 90% of workers' net income. So 10%, it was 10% of 90% of your net income. In 1999, with Bill 99, WSIB cut the amount in half that they put into injured workers' old age pension fund down to 5%. And they also cut benefits down to 85% of net income. So now your contribution to your old age fund is 5% of 85%, right? You can see it's going down. They said that injured workers, if they want to pay out of their own pocket, could contribute an extra 5% into that fund if they decided to make up for, the 10% that it was before.
So we just have so much money at that.
Well, that's the thing. That's the thing. Yeah. So here's the calculation. Say you take a worker with an annual salary of $50,000. If they were employed, their employers. This is 2022 rates. Their employers and they had to contribute 5.7% of their gross income into the CPP plan. So that would work out to just over $2,600 each. And so the total amount that they would be putting in every year would be $5,302 into their CPP, right? And then that contributes to their old age pension. Under the WSIB's loss of retirement income pension at 5%, 5% of the net benefits based on 85% of $50,000 gross works only out to $1,674. So most workers are going to end up with that $1,674 contribution compared to $5,300. Pretty big difference, right? Now, if the workers have enough money on the side to pay out of their own pocket for the other 5%, they're still only up to $3,208, right? No matter what, they're way under what they would be getting with CPP. Oh, there we go. And what's interesting, and what injured workers recognize immediately, is that 80% of workers on workers' compensation claims opt not to put that voluntary extra 5% in. And we can talk about why in the following quotes. I mean, basically, they don't have the money, right? So they're asked, what happens if you're on claims, after 12 months of being on claims, you're asked, you're told you're going to be going on to the LRI plan, and do you want to contribute? And then workers have the choice. Make up your mind right now. Tell us, you're going to contribute or not. You can't change your mind after. So that's also another big problem. And also, during those first 12 months, there's no contributions whatsoever, which is another big problem, but we won't get into every detail. So how did the government justify cutting workers' old age retirement pensions in half, injured workers' old age retirement pensions in half? So we went back to the parliamentary records for Ontario. They're called the Hansard records. And we looked at debates for Bill 15 and Bill 99, and they both talked about these sorts of things. The Canadian Federation for Independent Business was a big voice in this debate. And so, for instance, and so did sort of conservative MPPs, and they're mostly talking about affordability. Like CFIB was saying, we recommend revisiting the retirement pension issue, scaling back the future economic loss awards that have turned out to be far more costly than even the most generous costings. Our mandate shows that 81% of our small business owners favor such a waiting period. And then the MP, if we don't get costs under control, there will not be a viable, self-sustaining workers' compensation board to deal with future injured workers. So it's very alarmist language. Meanwhile, people voting, saying this isn't fair, were saying things like, the important thing to remember is injured workers don't disappear when they're cut off workers' compensation. They're forced to go onto social benefits. Their lives and lives of their family are damaged. The culture shift at the Workers' Compensation Board is essentially a shift away from the basic principles of workers' compensation. And another speaker from Waterloo Regional Labour Council was basically saying, yeah, before this bill, 10% of every award was set aside for pensions, retirement pensions. Now this is being cut to 5%. This is a time of life when people are most vulnerable. This is just basically about poor insurance. So we went and interviewed injured workers as well as people who are experts on workers' compensation schemes and advocates about this issue of injured worker poverty and old age when they've been on. And in our study, I think I missed a slide or something, but we interviewed, or maybe it's next slide, let's see. No. We interviewed workers who'd been on workers' compensation claims for at least 5 years. So maybe they're on claims and then maybe they went back to work. We wanted people to have had a significant period of time on claims, a certain chunk of their working life where they're affected by this LRI thing. So we conducted some interviews, and the interviews helped us to understand why workers on workers' comp can't afford to contribute the extra 5% to bring their retirement pension contributions back up to 10%. So here's a quote. The WCB are going to put that 5% into my account, which was loss of retirement income. They asked if I want to contribute another 5%. But I opted no because I was so in debt. I had to pay my credit cards. I had to pay people back. I borrowed money when I was trying to get a check for my injury. We also heard stories of despair, saying, I just don't know what my old age is going to be like. So here's someone saying, after my work-related injury, I lost my home. I end up divorced. It's been very difficult. I'm lucky I'm not homeless. Financially, it's been a total nightmare, and I don't see any changes in sight. I have very little hope for what I'm assuming will be a relatively short future, because you can't go through this type of financial stress and hardship without it having a major impact on you, and so on. So just to wrap up, what's really important here, I mean, we're talking about a change that happened a number of years ago. But when we started looking at it, it was when the Workers' Compensation Board was giving all this money back to employers because they have a surplus and they don't know what to do with the surplus, right? And we're thinking, well, here's an idea. So if in 2021, injured workers would have received $55 million more in LRI payments if the WSIB was still putting in full 10%, right? So it's just, but meanwhile, the $1.5 billion rebate went to employers in 2022. So tiny little amount that would go back to injured workers to get the LRI fund to where it was compared to what they're giving back to employers. Politics of Bill 99 back in 1998, we're talking about fiscal responsibility, financial scarcity. Employers are expected to self-fund half their pension contributions, but then when we actually do have the money with a surplus, none of this discourse is remembered anymore. And so the main issue here is what is the principles? What are the principles for workers' compensation? Because it seems that workers' compensation were established in recognition of risks associated with work as a last insurer, and the Workers' Compensation Board as the last insurer should make up income losses faced by workers, including retirement pension income losses. So it's something that's been kind of in the shadows that not many people have been talking about because they tend to focus on working age issues, and this is like age 65 and older. But and every single province across Canada has, except for one, Northwest Territories, has made this change actually in the 1990s. But no one's talking about it. So I'm talking about it. And that's it. If you want to read the paper, it's available for a free download. Thank you. And if anyone has any questions, we have a couple of minutes. Oh. Time's up, see? Okay, stop. Steve and then Paul. Yeah. Oh, well, we can start with Paul and then go to Steve then. Yeah, since you have.
I'll be quick.
Okay.
Ellen. Ouch. When
I'm gonna time you. Okay.
Yeah. You guys are making me take longer now. When they went from the 10% to 5%, like I remember Mike Harris's statement about the return to work and reducing it to 85%. His justification on the legislature was to encourage workers to get back to work. But the problem was they were already implementing forced return to work. So it was fluff. It didn't mean anything. So now with this 10% to 5% reduction, was there any money, aside from what was said, was there any numbers or anything, do you recall?
No, I mean, they're using the discourse of financial scarcity to justify making a lot of cuts to injured workers. And because there weren't very many people who were thinking about this issue, no, it wasn't in the media. No academics were picking up on it. No one's talking about it anywhere. It all just passed all across Canada, every province. It was just a cheap money grab. Yeah. See?
So, Ellen, thank you so much for your presentation, and thank you for doing this research. From the injured worker community, this is one of the issues that's been floating around for years. There's an issue of human rights discrimination because of age that we've been raising as well. Well, there's so many things, it didn't have legs. But after you did your research and you presented to us in the fall, legs grew. We now have a working group who has met with the Minister of Labour twice, which is the first time in this Conservative government in 5 years that they would even meet with us. And the Minister is saying he wants to do something about this. So, there's a direct link, it seems to me, when we've got, someone from the School of Public Health of Waterloo doing a paper that they're paying attention to, where they oftentimes don't pay attention to us raising those same issues. So thank you so much for doing that work and working alongside us for years.
Another example of academic community collaboration and the benefit of it, for sure. I think this will be the last one. Yeah.
So, Ellen, I also want to thank you so much for this research. It's so important, highlighting where poverty comes from in the injured worker community. I have a comment, and that is about Weiler. I pronounce it Weiler. And your quote there, and I'd just like to remind the crowd that when he came out with his report, he said two things. One is that injured workers should receive, there was no reason to have them be paid anything less than their full salary because they had given up the right to sue, and that was the right thing to do. And he said that the system should continue to pay the CPP contributions to Ottawa. And so he did not propose a loss of retirement income component. He said CPP should still be paid, et cetera.
Yeah, and when we were doing our research on the provinces across Canada, because we wanted to know if Ontario is just the bad boy province of Canada, bad person province, we realized that they were all shifting over, but it was really interesting to look at the language in some other provinces, and they didn't say 10%, they just said equivalent to CPP, whatever it is that year, right? Really explicit in the other provinces, and now that's changed and it's gone, and they've all, but yeah. Okay, thank you. So next we have, I don't have my schedule right here. Paul, yeah, come on up, Paul. Next we have Paul Taylor, who's going to come and speak to you about